Hey. Hey, Lisa. We're getting set up here. We'll get started in a little bit. Hey,
Hey,
step
how are
back.
you?
Yeah.
Hi. Sorry, I'm gonna get some better lighting. All right.
You have children in your home.
Yeah, sorry for the background noise.
Oh no, home. So it's
There's a few little ones around here.
our new world now.
Yeah.
I was on the phone with customer service with my provider, and they were like, just I could hear everything that was happening in their background, and I was like, you must be working from home. I get it.
Yeah, and then sometimes it's kind of difficult to find a quiet place. So, sorry again for the background noise.
It's totally normal now. Um, so we'll give a few more minutes and then we'll get started
Okay.
and then allow you to introduce yourself, um, your gender and your titles. That's what we're here with Walker. So let's give a few more moments for people to join and we'll get started.
Sorry, it's a little spotty.
Hey, everybody. If you have questions regarding the services today, feel free to drop a message in the comments. We'll address those at the end. We'll be on live for about 25 to 35 minutes today. And so that should give you all more than enough time to, drop your comment and give us a chance to address it. So I'll introduce myself first. I am David Wilson. I work for Walker Health. My title is social media. And so I've been doing this role for about 9 now. And so I, help Whitman-Walker with, on our social media platform. My pronouns are he, his, and that's me. So,
Okay. So, hi to everybody that's connected so far. My name is Yesenia Obando. I work for La Clínica Del Pueblo Empoderate, and I'm a community health worker with them. Uh, and yeah, I'm sorry. So I've only been there for a few months, almost going on to a year, but I have experience in the field, so it's something interesting to be working with.
yeah. And what are your pronouns?
My pronouns is she and her.
Okay, great. All right. So thank you for being here today. We have a lot to cover, so I'll jump right in. I want to tell the audience there that, during the last few months, Whitman Walker's Community Health Department has expanded its outreach efforts to social platforms. We cover various topics about HIV, STI, sexual health practice, access to care, social health, and public health intervention. Our series of outreach sessions right now focus 19 and ways that you can manage your sexual, personal, and mental time. So, Women Walker Community Health Team here to educate and support you. Today, I am joined by one of our community partners, like Clínica, and we will discuss services provided by both teams during COVID-19. So, let's get into it. Just
All right. So I have a few questions. My first question is if you can tell us about your agency and the services you provide at your agency and the populations you guys most likely work closely with.
Yeah, absolutely. So, Whitman-Walker has, and we have probably been often feel, critically led care system. So, Whitman-Walker provides a stigma-free, clinically humble, vital health care to gay, lesbian, bisexual, transgender, and gender expansive and queer communities, as well as to those who are living with or affected by HIV. And those individuals who may not be able to afford pay or otherwise who feel uncomfortable in other healthcare settings. So, we have a ton of information about what we do. So you can learn more about Women Walker at walker.org. But we offer an array of services. Those include care, HIV care, preventative care, management of urgent, as well as PrEP, gender affirming healthcare, medical care, management, aesthetic medicine, gynecological care, integrated wellness services. It goes on and on, right? Hormone therapy, um, trans care navigation, HIV and STI testing, counseling and treatment, HIV specialty care, breast health initiatives, as well as pharmacy services, dental care, mental and behavioral health. So we do a lot. We do a lot, and we've been serving our community.
I see. So the next question is, are you guys accepting new patients?
So yes, we are currently accepting new patients. We're PrEP, and diagnosed HIV positive care. Um, so COVID-19, for the safety and protection of our community. Am I breaking up? Can you hear me?
Yeah, you're breaking up a little bit.
I'm sorry. Is that better?
That's fine. Yeah.
That's better? Okay.
Yes, yeah.
All right. It's probably the way my phone was positioned. Um, so hopefully you all can hear me better. But yeah, so we, are accepting new patients, through PrEP, and newly diagnosed HIV positive linkage to care. And so to ensure safety and protection of our communities during COVID-19, we've moved to telehealth services. And so this is the model that we are utilizing for most of our services. It has prevented us from accepting, new patients for medical care, behavioral health, as well as our dental services. But however, we still have the PrEP and the positive linkage to HIV care. So we're still doing those services, but our telehealth model allows us to have electronic video services, and also, we take services through our audio visits and phone calls. Did I lose you, Jacinda? All right, I thought I lost you for a minute. I think we're back.
No, sorry. My connection was bad. I'm sorry about that.
No problem. So yeah, I think I covered. Let everybody know that we are accepting new patients for PEP and PrEP and newly diagnosed HIV linkage to care. So yeah.
Okay. Um, so what services is Whitman-Walker Health currently providing and how can patients access them during the COVID-19?
So yeah, that's a good question. So Whitman-Walker is currently offering in-person scheduled appointment only COVID-19 testing. So we are offering COVID-19 testing, but it has to be scheduled and it's appointment only. We are also offering care for emergency PEP services, our PrEP clinic, health and wellness clinic, as well as newly diagnosed HIV, entering HIV care for the first time, gay men sexual health and wellness. I already said that, but medical care and behavioral health, which includes therapy and psychiatry. We also have legal services, research, public benefits, and insurance navigation, as well as care for and navigation for gender affirming, youth care, as well as peer support and nutrition services. All of these are current over the phone. So you can also find a list of these services online at Whitman-Walker, for whitmanwalker.org/COVID service updates. Unfortunately, our walk-in HIV testing and STI services, we are currently closed due to the COVID-19 pandemic, but we do still have a process for patients experiencing STI symptoms and who are seeking treatment. So for those particular inquiries, you can call us at 202-797-4437. Or, you can also keep an eye out for, us, or you can also reach out to our website and see, what other services we are offering around HIV testing, STI testing, PrEP, and PAP. I'm trying to get my camera to stay still.
Okay. So the next question is, how can patients access PrEP services, and how can patients that are already on PrEP access refills during COVID-19?
Yeah, so another good question. So for new or existing patients who need access to PrEP, they can call us. They can call us at 202-939-7690. And the appointments will be taken via telehealth, which is good. You don't have to come in person. So we can do that over the phone or over video rather than in person, right? If you need lab work done, then we can submit a request through LabCorp, which is the company that does all of that for us. And you can also visit labcorp.com to find a location where you can go to get your blood drawn or any of those services. And so if you are due for labs, and you want to get a refill on your prescription, that's not a problem. We are still dealing with that, and we actually are waiving that typical requirement for those labs. So because of the pandemic, we're not holding your prescription. If you need to get a refill, we'll still do that. So glad that we're still offering that. Our pharmacies and the PrEP clinic are located in Southeast and Northwest. They're working extremely hard to get patients get their medications delivered timely and refilling those prescriptions timely. So we conduct wellness checks with all of our existing patients monthly to ensure their needs are being met, and that we're doing whatever we can at Whitman-Walker to ensure that we continue to provide as best of services as we can during this time.
Okay, that's good to know. So the
Yeah.
next question is, how is Whitman-Walker providing PEP?
So that's a good question too. So PEP is right now it's being provided over the phone. And so we have an emergency line that folks can call, and that number is 202-797-4439. And so the hours for those PEP services are from 9 a.m. to 4 p.m., and that's Monday through Friday. You can always call this line, if you need to speak with a counselor or if you want to be assessed over the phone. That is the number that you'll want to reach us at. We do want to let people know that PEP process could take 2 to 3 hours to talk to the counselor and get through all that information. And so you must, if you're calling, you got to be sure that you set aside enough time to complete that process, right? And when we do that, we'll make sure that you receive your medication within your 72-hour window. And so that's very important. So to give a little more detail on the process, once your counselor assesses you, your appointment will be made on your behalf, and then you'll be screened by a nurse. And then you speak with the physician over the phone, and then you get your PEP prescription.
Oh,
Yeah.
okay. Okay.
Yeah.
So how are you addressing requests from patients to food access, medical insurance, and other social determinants of health?
So we are calling our patients to ensure that they have access to food and water. So our public benefits department is working via telehealth and over the phone to do that. So we are meeting with clients to help them with their insurance navigation needs. And if you are interested in that service, you can reach them at 202 745-6151. Um, and you can also reach out at our legal department, which is at 202-939-7630. And we also have a nutritionist line that you can reach us at 202 745 7000. And all of these services we're offering via telehealth, so we're still able to address client needs at this time. Also, our pharmacy, like I mentioned earlier, we have implemented delivery only services for prescriptions. And so we encourage people to stay at home and avoid the hassle of having to pick up a prescription. So this is our reason for providing that service. We don't want people risking their health and their well-being. And so we're doing this prescription delivery service so that people don't actually have to be out and about. They can actually get their medications filled in the comfort of their home. Yeah.
Oh, okay. Um, so the next question is, are you providing hormone therapy?
We are. So if folks are, interested in gender affirming care, they can always contact us at 202, that's 797-4457. So at this time, we are not accepting new patients for in-person medical care, but we are working, hard and creatively to reopen this service. So if you have already started your gender affirming care at Whitman-Walker and you are in need of support, you can call us at the number I mentioned, 202-797-4457. If you are looking to refill a hormone therapy prescription, you can call 866-724-1805. You just got to be sure that you have your 9-digit prescription code for the refill, and that is usually located on the label of your previous bottle. So make sure you hold on to that bottle because it has that number, so that you can get your refill.
Okay. Another question is actually about legal services. Are legal services still being provided during COVID-19? If so, how can patients access?
Yeah, so we are offering legal services. They are still being provided during COVID-19. Again, this service is being offered via telehealth. So again, that's a video chat or a phone call. And so to access that service, you can call us at 202-939-7630. Yeah.
Okay. Um, so what are the hours and requirements for clients during the COVID-19 for your guys' clinics?
So that is a good question because there have been, some slight changes. We are still open from, 9 a.m. to 5 p.m. right now. So that is good. We're available during those hours. To ensure the safety of both our clients as well as our staff, we ask all clients to call the 202-745-7000 number first, and schedule an appointment for COVID-19 services. We really don't want, people showing up for those services. We want you to call beforehand. We can schedule an appointment and make sure that you can be taken care of before arriving at Whitman-Walker. So you can also call that 202-745-7000 number to schedule an electronic video or audio service via, telehealth. And so you can get that appointment at that number as well. What else? We are currently accepting walk-ins for we are not accepting walk-ins for any of our other services. Everything is by appointment only. And so I think I got something else I want to mention there. If you all know someone who is experiencing COVID-19 symptoms, or you or anyone else that think they've been exposed to COVID-19, we're here to help. And so we want to help you get screened, tested if necessary, and all you have to do is call us at our favorite number, 202-745-7000, and you can click option 2, and that'll get you straight to appointments, and there'll be somebody there that can guide you on how to set that up.
Okay.
Yeah.
So very last question. So what is the best way to get in contact with someone at Whitman-Walker?
So, as I mentioned, our favorite line, the best way to get to contact with us is, we have tons of numbers that you can reach out to us. And so we actually have a website set up for all the, COVID service updates. And that website is Whitman-Walker.org / COVID service updates. At that particular link, you could actually find all the services that we are offering at this time. It's that link is, and that page is constantly being updated, and so that is the best resource to really see what we are doing. And on that page, you can there are direct lines to particular services. So if you're looking for a particular service, the best approach is to call that direct line. If you can't find what you need at that particular site, you can call our main line at 202-745-7000 again. And you can select an option from the phone tree that's most suitable, and that'll connect you to the specific department that you need to speak with. You can also follow us here on Instagram. You can follow us on Facebook, on Twitter. We are constantly posting about these things, literally all the time. Sometimes we have sessions like this twice a day. You can also look at our website at www.whitman-walker.org. And yeah, those are all the ways to get the most up-to-date information. Yeah. So I
Okay.
know I've talked a ton about Whitman-Walker Health. I've discussed the services that we offer. So, tell us what's happening over, at La Clinica. What are you working on? What do you guys offer?
So for our general services, we La Clínica, we offer the medical services, language access, mental health, and substance abuse. And
Mm-hmm.
then for Empoderate, which is included with the Community Health Action Group, which is a sexual health, health promotion program, health and gender
Mm-hmm.
program. We're located on the in Mount Pleasant, close to.
Mm-hmm.
So it's the community center is called La Casa. Um,
Mm-hmm.
I'm sorry.
No, you're good.
So for the specifics right now, the services that we're offering during this COVID-19, um,
Mm-hmm.
we're doing we're still doing our navigation services, and I'm sorry, give me 1 second. And we always do so we still have the mental health services, legal services. We will navigate our clients towards those if they need those type of linkage. Okay.
Yeah.
Um, so, well, basically, we're pretty much, even though we're remotely operating, we still have all of our navigation
Mm-hmm.
systems up and running, which is anything from mental health, legal services, employment readiness, primary care, HIV care, health insurance enrollment, hormone treatment and adherence, housing, food access, and among other things.
Yeah.
Um, right now, for STI screenings and treatment, we're only internally La Clínica del Pueblo medical patients are being seen at the clinic. If
Mm-hmm.
they're not medical patients of La Clínica, we refer them to different clinics in the area as well. Uh,
Yeah.
for
So
PrEP
we
and
have a question too. Do you also have walk-in services for La Clinica?
unfortunately, at the moment, we do not have walk-in services
Okay.
at La Clínica, specifically from Empoderate. We are doing only appointment-based HIV testing in our site,
Okay.
um, and uh, in-home testing. But other than that, we're not offering any other services at the center. But anything else that I've mentioned, we're doing it remotely, and they could just reach out to us through our Facebooks, our Instagrams, and
Yeah.
our phone number.
Yeah, I also want to
Uh,
add that I do have a pinned comment there that has, both the Whitman Walker services number, so you can call us there, and then services at La Clinica. We have the number there, which is 202-870-6615. And so if you need to get in contact with either of us, Those are the numbers where you can reach us, and it's pinned right above the comments. Yeah. What else? What
Thanks.
else is going on? You got anything else that you want to
Um,
share with
bes-
us?
Besides our appointment-based HIV testing or in-home HIV testing, we also do have condom distribution by mail. So if anybody is
Oh,
interested in
nice.
receiving a packet of condoms, we can get in contact with us, and we'll gladly ship out a
Oh,
packet
so
of
do we call?
condoms.
Do we call, or is there a website we call?
Yeah, you guys can call the number that's
Mm-hmm.
pinned there, which is the 202-870-6615 number.
Mm-hmm.
And then we can get you in contact with someone from the staff to help you navigate through the condom distribution.
Nice. And this is a random question: is lube coming with those condoms as well?
Actually, yes. So
Okay.
so it will be actually so it will be some condoms and lubes included in the packet.
Great. Okay, so that's a good
Yes.
offering.
Yeah. So anybody that's interested, please, they're welcome to get in contact with us. And then another thing that I did want to mention is we do still have our group health education sessions. Our education group sessions are every Tuesdays and Thursdays at 5. Right now, we're having them virtually through our Facebook Lives.
Oh,
And
nice.
then, yes, and then they can connect to through Facebook, which is facebook.com/empoderate, and they
Mm-hmm.
could find our page like that.
Gotcha.
Um, so just a brief comment. Our hours are still always from 9 to 5. They can reach us anytime from 9 to 5. Our insight for testing, the appointment based, it's from 10 to, I'm sorry, 10 to 2 on Tuesdays and Thursdays.
Mm-hmm.
And, uh, I'm sorry, it's actually from 10 to 6, Tuesdays and Thursdays.
All right.
Yes, and to make an appointment for the appointment based at our HIV testing in our site is our 202-870-6615.
Okay.
Um, and just a reminder, unfortunately, there's no walk-ins, but they're more than gladly to reach out to us.
Thanks. I mean, it's great to hear about those services. I definitely, think that it's good both that Whitman-Walker and La Clínica is here during this time to help folks. And so it's good. And it's great to have you on live with me. I just want to add that, I want everyone who's watching to follow us on Instagram, Twitter, and Facebook. So you can follow Whitman Walker at, Whitman Walker, or you can check our website at whitmanwalker.org. And again, you can find the most up-to-date information there. But I want to thank you for joining us, Jasenia, and for the great work you all are doing at La Clinica. I hope my accent I'm trying my best.
No, it's okay.
And
It's good.
I mean, we appreciate what you're doing for the community.
No, thank you for having us on here. I very greatly appreciate it. And you guys are also doing an awesome job.
Thank you. All right. Well, I
All
hope you have a
right.
great day. Continue to stay safe, stay home, be,
Yes.
physically distant, practice all that, wear your mask when you leave the house, stay healthy.
Yes. Thanks. You too. Do the same.
All right. Talk to you
All
later. Bye.
right. Bye.